If the medication doesn't work, it's important to know what to do next. The first thing to do is to review whether there's anything new happened, like a urinary tract infection or any other trigger. But if that's not the case, it may be that you need the next stage of treatment, which sometimes are more interventional. The first treatment to mention is Sativex, or the cannabis derivative spray. Now that can be useful as an add-on treatment, which means that you add it on top of the other medications, and it can help some people. Unfortunately, it's not a fantastic drug in that it doesn't help everybody, and it's said to help about half of people with MS. And if it helps you, you can get at least a 20% benefit in your symptoms. It's taken as an oral spray, and you can vary it at different times through the day. So if you think this might be helpful, it's worth talking to your MS specialist or your neurologist about. Most GPs unfortunately can't prescribe it. If Sativex isn't helpful, then there are other treatments to consider. The first is botulinum toxin therapy. Now this is an injection that goes straight into the muscle. It doesn't help everybody, it only helps if you have a very focal problem. For example, if you have difficulty opening your hand for cleaning it, it can help. Or if you have a problem, say, with getting the heel down on one foot, it could help. But it won't help the generalized problems of spasms. If botulinum toxin isn't helpful, the other treatments you could think about are intrathecal treatments. And that means injecting drugs directly into the spine, into the fluid, the cerebrospinal fluid, or CSF, that surrounds the spine. And you can inject either baclofen or phenol. Phenol is an interesting drug because it sounds a bit scary. It's a destructive agent which can actually destroy the nerves to the legs. But actually in people who can't walk and who can't use their legs, then it can be very effective at taking away all the tone and taking away pain. So sometimes in people who have very bad MS, it can be helpful.